Hello, this is Lainey interviewing Dr. Singletary. The first question I have for you is how much and what type of education did you receive?
After finishing high school, I went to undergraduate at UNC Chapel Hill for 4 years, getting an undergraduate degree in biology and minor in African American studies. I then actually took 2 years and studied education. And then after that, went back to medical school. After teaching high school for 2 years, went back to medical school for 4 years. Finishing medical school in 4 years, I then had to do 3 years of training where you're partially working and partially going to school and getting paid 1/10 of your salary. And then I got to go to work. So 8 years of undergrad and well, no, 4 years of undergrad, sorry, and 4 years of medical school and 3 years of training afterwards.
How much and what type of work experience do you have?
Well, I worked for 3 years first in the partial work, partial school atmosphere residency in emergency medicine. And then for the past 14 years, I've worked in emergency medicine as a attending um, at Wake Med and also in California.
What do you like and dislike about your job?
Well, I like most of the things about my job. My job is challenging. I like the intellectual challenge. I like solving problems. I like getting to do procedures. I like to get into fix things, taking things and making sort of an art of it, fixing a laceration and making it look pretty. I don't like when I'm not able to fix things, when things get frustrating, when people are sick and you can't fix them, when people die. I don't like that part. Um, but most of my job I like because most people, they have something they can fix. You can reassure them, you can make them feel better. And I like doing that.
Have you seen a relationship between the amount of stress and the increase in your salary over the years?
There's not much change in the last 14 years between the stress and the increase in my salary. The stress has stayed about the same. The salary has stayed pretty much the same. Um, Prior to that, though, in residency, when I was getting paid 1/10 the salary, I really had half the stress, though. So in that way, 14 years ago, there was a big change, but since then, not much change.
How many hours do you usually work in a week?
That is extremely variable. That's the great thing about emergency medicine is that fluctuates anywhere from working 7 shifts, working 7 days a week, and to working 2 days a week, depending upon what else is going on in my life. So that can change from anywhere from 60 hours a week to as few as 16 hours a week. So it's very variable. And then in addition, there's always studying and adding on additional training because you have to learn or you're going to be obsolete in medicine.
Do you have to travel, and if so, how much and to what kind of places? Is traveling a benefit or an added stress?
Well, with my job, we have multiple sites to work at, and so there's a little bit of travel there in between the sites. The emergency departments can be anywhere as far as an hour apart. Um, that is probably a bonus because that means that we get to work in different practice locations with different populations, which is really good to see the differences in people and populations. So, sort of travel, and yes, it's a benefit.
The last question I have for you is what would you do differently and the same with regards to your career?
I'm quite fortunate. I like what I do. I get to do a lot. I've had a chance to do both academic work, work with residents, teach. Also, I've had a chance to do administrative work. There's lots of open doors in my field and lots of open doors in our department. So there's lots of chances to do many different things. So I wouldn't change much. I have been blessed with making some pretty great choices, and I'm pretty happy with where I am.
Thank you, Dr. Singletary.
Thank you, Lainey. It was my pleasure.